Leo kayo kurjasinibetili bengang tingan dodai ijuingbek santon der. They ten vi bengang tenan, konko ak hei paun, doshetian, moren nodongne. Darthai, altemen bum moren bengang tian kobai. The diabetic food formula. Leveraging everyday nutrition for natural blood sugar management and comprehensive metabolic health. The diabetes mellitus DM, affecting hundreds of millions globally, stands as a critical and escalating public health crisis. When this chronic metabolic condition, stemming from either insufficient insulin production, type 1 diabetes, or impaired cellular response to insulin resistance in type 2 diabetes, results in a sustained state of hyperglycemia. 2. If left unchecked, this high blood glucose accelerates damage to the body's delicate vascular and nervous systems, manifesting as devastating complications, including cardiovascular disease, renal failure, nephropathy, nerve damage, neuropathy, and irreversible vision loss, retinopathy. 3. While pharmaceutical interventions remain essential for establishing baseline blood glucose control, effective, long-term diabetes management is fundamentally contingent upon a holistic approach that integrates regular physical activity, committed medication adherence, and crucially, a meticulous and informed diet. The power of nutrition in diabetes extends beyond mere restriction. It involves strategically incorporating specific, nutrient-dense foods that possess inherent anti-diabetic properties, actively helping to modulate insulin sensitivity, slow glucose absorption, and mitigate the systemic inflammation that drives complications. This extensive guide will delve into the scientific rationale behind several key everyday foods, detailing how their unique biochemical compositions enable them to naturally assist in blood sugar regulation, thereby offering diabetic patients a powerful tool for enhancing metabolic control and improving overall well-being. The biochemical rationale for food-based management. The goal of utilizing specific foods in diabetes management is to achieve one or more of the following biological effects: enhance insulin sensitivity, improve the cellular response to existing insulin, allowing glucose to enter cells more effectively, slow carbohydrate digestion, reduce the rate at which glucose enters the bloodstream, thereby flattening the post-meal glucose curve, postprandial glucose management. 4. Reduce oxidative stress and inflammation, combat the chronic low-grade inflammation that characterizes diabetes and accelerates vascular damage. 5. Support weight management, aid in reducing body fat, particularly visceral fat, which is strongly linked to insulin resistance. Functional foods with direct anti-diabetic mechanisms. Certain foods possess specific bioactive compounds that directly mimic or enhance the body's glucose-regulating mechanisms. 6. Bitter melon, Mamartica charantia, known widely across Asian, African, and Caribbean cultures. Bitter melon is perhaps the most scientifically studied food for its anti-diabetic properties. Insulin mimicry. Bitter melon contains several potent compounds, notably charantin, polypeptide, or P-insulin, and vicine. 7. Polypeptide P. It is structurally and functionally similar to bovine insulin, and all three compounds have been shown to exert a blood glucose lowering effect. 8. They enhance the uptake of glucose from the blood into peripheral cells, mimicking the primary action of insulin. 9. Glucose regulation. Charantin and vicine also play roles in suppressing the production of glucose in the liver. 10. Gluconeogenesis, and improving the body's utilization of existing insulin. 11. Nutritional value. Being high in dietary fiber, vitamin 12, C, and various antioxidants, regular consumption supports overall metabolic health and immune function. 13. Consumption tip: incorporating bitter melon into the diet, whether lightly stir-fried, boiled into a soup, or consumed as a tea or juice, can be a consistent dietary strategy for supporting glucose control. Cinnamon, Cinnamon verum, cassia. This ubiquitous spice has garnered significant attention for its potential to modulate blood sugar levels, primarily through improving cellular signaling. 15. Insulin sensitivity enhancement. The active compounds in cinnamon, notably the polyphenol methylhydroxychalcone polymer, MHCP, have been demonstrated to mimic insulin's effects on cells. 16. MHCP improves the efficiency of insulin signaling pathways, essentially making cells more receptive to the small amount of insulin the body produces. Digestive action. Cinnamon also contains compounds that can inhibit digestive enzymes like 17-teens amylase and 18-teens glucosidase, slowing the breakdown of carbohydrates in the digestive system. 19. This results in a slower, more gradual entry of glucose into the bloodstream, helping to stabilize blood sugar levels. Lipid benefits. Studies, including those referenced in journals such as the Journal of the American College of Nutrition, suggest that daily intake of even small amounts of cinnamon can improve fasting blood glucose and simultaneously reduce harmful 20T, LDL cholesterol and triglyceride levels, offering crucial cardiovascular protection. 21. Consumption tip. Integrate 22 sim 1 gram half a teaspoon of ground cinnamon into daily meals, sprinkled on low glycemic breakfast options like oats or unsweetened yogurt, or stirred into tea or coffee. Supporting metabolism and cardiovascular health. Diabetics face a significantly elevated risk of cardiovascular events. 24 foods that benefit the heart and reduce inflammation are doubly valuable in diabetes management. Green tea. Camellia sinensis. 25. Green tea, renowned for its antioxidant profile, offers distinct metabolic advantages for diabetic patients. 26. Polyphenols and catechins. It is extremely rich in polyphenols, especially catechins, with epigallocatechin gallate. 27. EZGCG, being the most potent. 28. EZCGC functions as a powerful antioxidant, combating the oxidative stress that damages blood vessel linings and contributes to insulin resistance. 29. Glucose metabolism and T2D risk. Research from various epidemiological studies, including those at the Harvard School of Public Health, has correlated regular, unsweetened green tea consumption with a reduced risk of developing type 2 diabetes. EZGCG is believed to improve peripheral glucose uptake and enhance 30. Beta cell function. 31. Cardiovascular protection. Green tea helps lower total cholesterol, increase HDL cholesterol, and improve overall endothelial function, directly reducing the heightened risk of heart disease inherent to diabetes. Consumption tip. Drink 10 to 3 cups of unsweetened green tea daily, replacing sugary drinks or juices. 4. Fatty fish and omega-3 fatty acids. While fish does not directly lower blood sugar, it is vital for mitigating the cardiovascular complications associated with DM. Omega-3s, TTA and TTAHA. Fish such as salmon, mackerel, sardines, and tuna are primary sources of the long-chain omega-3 fatty acids. 32. These fatty acids are potent anti-inflammatory agents that help reduce systemic inflammation and decrease the risk of chronic vascular damage and atherosclerosis. 3. Improved lipid profile. Regular consumption of omega-3s is scientifically linked to lower blood triglyceride levels, which is crucial given the prevalent dyslipidemia in diabetic patients. 4. Protein source. Fish provides high-quality lean protein, which aids in satiety, helps preserve muscle mass, essential for healthy metabolism, and does not rapidly impact blood glucose. Recommendation: incorporate fatty fish into the diet at least twice per week to ensure adequate omega-3 intake. 35. IV. Foods for satiety and absorption control. Fiber and fats. Foods rich in fiber and healthy fats are essential for the mechanical and temporal management of blood glucose, slowing the absorption of glucose. 36. 5. Nuts and seeds. Chia, almonds, walnuts. Nuts and seeds represent an ideal snack and meal addition for diabetics due to their unique macronutrient composition. Nutrient density. They are high in healthy unsaturated fats, fiber and protein, and crucially have a naturally low glycemic index, GI. Their consumption does not cause rapid glucose spikes. Fiber power chia seeds. Chia seeds are exceptional, containing large amounts of soluble fiber. When hydrated soaked, they form a thick, mucilaginous gel in the stomach and intestines. This physical gel dramatically slows the digestion and absorption of carbohydrates and fats consumed concurrently, effectively flattening the glucose curve. Magnesium and insulin. Nuts like almonds and walnuts are excellent sources of magnesium. 37 Magnesium plays a critical cofactor role in insulin action and glucose metabolism. Studies have linked adequate magnesium intake to improved insulin sensitivity. 38 Consumption tip: choose unsalted, unroasted varieties to avoid excess sodium and potentially damaging processed oils. A small handful of nuts or a tablespoon of soaked chia seeds daily can significantly improve postprandial glucose control and satiety. Whole grains and legumes. The foundation of the diabetic diet relies on fiber-rich, slow-digesting carbohydrate sources. Whole grains. Unlike refined grains, white rice, white flour, whole grains, oats, brown rice, quinoa, barley, whole wheat, retain the bran, germ, and endosperm. 40. This composition ensures a high content of soluble and insoluble fiber, B vitamins, and trace minerals. The high fiber content ensures a slow, gradual glucose release, promoting stable blood sugar levels over time. 41 Legumes, beans, lentils, chickpeas. Legumes are a nutritional powerhouse, combining complex, low 42 GI carbohydrates with significant amounts of protein and soluble fiber. 43. This synergy is highly effective at slowing digestion and regulating blood glucose. Studies show that including beans and lentils can significantly reduce 44 TI1C, a marker of long-term blood sugar control, and improve heart health. 45 Recommendation: whole grains and legumes should consistently replace refined starches in the diabetic diet. Leafy green and non-starchy vegetables. These are the free foods of the diabetic diet. Nutrient-dense but very low in calories and digestible carbohydrates. Low glycemic load. Vegetables like spinach, kale, bok choy, and broccoli have minimal impact on blood sugar. Magnesium and K. They are rich in micronutrients like magnesium and potassium, which are crucial for optimal insulin activity and balancing blood pressure, a major comorbidity of diabetes. Antioxidants. The high antioxidant content protects against the oxidative stress and inflammation that fuel diabetic complications. 46 Consumption tip: aim for 2 or more servings of non-starchy vegetables at every main meal, often consumed first, to maximize the beneficial fiber effect. Integration into the management protocol. These foods are powerful allies, but they are not substitutes for comprehensive medical care. Moderation is essential. Even healthy foods like nuts are high in calories and should be consumed in measured portions to support weight management. 48 Synergy with medication. These dietary tools work best when combined with the consistent, prescribed use of insulin or oral anti-diabetic medications. Patients must never stop or adjust medication based solely on the consumption of these natural foods. Monitoring and feedback. The efficacy of these dietary changes must be confirmed via regular blood glucose monitoring, checking pre- and post-meal levels, and clinical measurement of avoidance of sweeteners. The benefits of green tea, cinnamon, or yogurt are completely negated by the addition of sugar, honey, or sweetened condensed milk. Diabetic patients must commit to consuming these items unsweetened. The management of diabetes mellitus is a lifelong endeavor rooted in discipline, balance, and awareness. By prioritizing these naturally blood sugar regulating foods, bitter melon, green tea, omega-3 rich fish, cinnamon, nuts, and high-fiber whole grains, patients like Mr. Thomas Finch can actively reduce their reliance on medications, mitigate the risk of severe complications, and significantly improve their metabolic health. allowing them to lead long, active, and fulfilling lives despite their chronic condition. Monitoring and feedback. The efficacy of these dietary changes must be confirmed via regular blood glucose monitoring, checking pre- and post-meal levels, and clinical measurement of HbA1c. Avoidance of sweeteners. The benefits of green tea, cinnamon, or yogurt are completely negated by the addition of sugar, honey, or sweetened condensed milk. Diabetic patients must commit to consuming these items unsweetened. The management of diabetes mellitus is a lifelong endeavor rooted in discipline, balance, and awareness. By prioritizing these naturally blood sugar regulating foods, bitter melon, green tea, omega-3 rich fish, cinnamon, nuts, and high-fiber whole grains, patients like Mr. Thomas Finch can actively reduce their reliance on medications, mitigate the risk of severe complications, and significantly improve their metabolic health, allowing them to lead long, active, and fulfilling lives despite their chronic condition.